All medical emergencies are managed in basically the same way. The algorithm for treating all medical emergencies is P, A, B, C, D. P stands for positioning of the patient. A is airway, B, breathing, C, circulation, and D is definitive care. The first step in managing all medical emergencies is to position the victim properly. For a conscious person experiencing a medical emergency, the position of choice is whatever is most comfortable for that person. For example, the asthmatic or anyone having difficulty breathing will likely want to sit up.
She's putting you up. Use your inhaler.
This is perfectly okay if the patient is conscious. As long as the patient remains conscious, meaning that their heart is pumping adequately, any position in which they are comfortable is acceptable.
All right.
In the unconscious patient, the position of choice is supine. Supine is horizontal with the head and heart parallel to the floor. The feet should be elevated slightly. The Trendelenburg position, in which the head is lower than the heart, is not recommended. The most common reason for a human being losing consciousness is low blood pressure. The brain is no longer receiving an adequate supply of oxygenated blood. That's why the supine position is the ideal position. When the head and heart are parallel to the floor, blood flow to the brain is increased and the patient can still breathe adequately. The Trendelenburg position is not indicated because although it does increase blood flow to the brain, it also decreases the effectiveness of breathing. The ideal position for all unconscious patients is horizontal or supine with their feet elevated slightly. The second step in managing emergencies is to assess the airway. In a conscious patient, especially if a conscious patient can speak, we know their airway is open because speech is breathing. If the patient can speak, we also know that their heart is pumping adequately simply because they're conscious. So in a medical emergency with a conscious victim, at the moment they speak to us, we have assessed their airway, breathing, and circulation just by listening to them.
Feel okay otherwise? Just itchy?
Yes.
Okay. Have you ever had any problems with penicillin?
Because we know they're breathing and their heart is pumping blood, we don't have to physically do anything for A, B, or C in the conscious patient.
So I suspect what we've got is
In the unconscious patient, airway management is important in saving their life. When consciousness is lost, skeletal muscles relax. In the supine position, the tongue, which is a large mass of skeletal muscle, relaxes and either partially or totally obstructs the airway. The technique for maintaining an airway in the unconscious person is simple. It is called head tilt chin lift. You place one hand on the patient's forehead, two fingers under the anterior tip of the mandible, and then simply rotate the head back. As the tongue is attached to the mandible, the tongue will be lifted off the airway when the mandible is rotated up. The next step in the unconscious patient is to check and see if they are breathing. Breathing can be defined as the exchange of air going in, air going out. While maintaining head tilt chin lift, the rescuer places their ear 1 inch away from the victim's mouth and nose, then looks at their chest to see if the patient is attempting to breathe. It is important to concentrate on what you feel or hear from the nose or mouth, because seeing the person's chest moving does not mean that they are breathing. Even when the airway is obstructed, the patient may still attempt to breathe with their diaphragm and intercostal muscles contracting in a somewhat normal manner. If you feel or hear air coming out of the victim's mouth and nose, then the airway is patent and they are breathing. However, if respiratory efforts are absent, the victim is not breathing. This is called apnea, and the rescuer must deliver 2 quick ventilations to deliver oxygen to the victim's lungs. The next step, C, is to check circulation. Through the first 2 steps, airway and breathing, we have now gotten oxygen into the victim's blood. We now have to ensure that this oxygenated blood gets to the brain and to the myocardium. While maintaining head tilt, we next check the carotid artery for a pulse. There is a simple method used to properly locate the carotid artery. While maintaining head tilt with one hand, place the index and middle fingers of the opposite hand onto the thyroid cartilage or Adam's apple. Next, slide these fingers down along the neck towards yourself until the fingers fall into a groove formed by the sternocleidomastoid muscle. The carotid artery is located in this groove. Check the carotid pulse for not more than 10 seconds. If the pulse is not present, or if there is any doubt if the pulse is present or not, chest compressions must be started. We are now supplying blood which contains oxygen to the victim's brain and heart. The last step in our management of medical emergencies is D, definitive care. Depending upon the situation, D may also stand for diagnosis, drugs, or defibrillation. The first 4 steps, positioning, airway, breathing, and circulation, constitute basic life support. We are keeping the victim alive. Definitive care means that we're now going to make authoritative decisions on what the problem is and on how to properly manage the situation. If you can establish a diagnosis of the problem, and if you have the appropriate drugs and equipment available, then treat the problem. If you're unable to diagnose it, then call 911. If you can diagnose the problem but are uncomfortable with what's going on, also call 911. Remember that your legal obligation during a medical emergency is to keep the victim alive until they either recover or somebody arrives on the scene who is better trained than you are and takes over their management.